When one looks at a map, there aren't roads to this part of the world on most of the standard maps. So I think that's a fair description of how it is in reality. It's quite a densely populated part of the world, but it's densely populated because historically this was the old Transkei, which was a homeland under the apartheid government.
It is a deeply impoverished community and people have nothing. People don't have access to health, they don't have access to water, they don't have access to electricity.
People here tend to rely on government grants for survival, either pensions or disability grants. Child support grants are the main source of income in this area. We're based at a hospital that was started by the missionaries in the 1950s. It's now run by the Eastern Cape Department of Health, but its surrounding clinics and for the community around this hospital, there's still massive health needs, massive other development needs. The rural development is a priority because really people here have got little by way of opportunities and often little by way of skills, and they need outside help to be able to reach their own potential. When Jabulani started, it was really two couples at the hospital with a dream to do something beyond just our daily jobs at the hospital.
The idea of it is not to be a kind of an instrument for handouts, it's an instrument for development and giving people independence rather than dependence. And that's a very difficult line to walk, but I think that's very important to us.
We hope Jabulani will be a vehicle and an umbrella in a way for people who've got a passion to serve people who are less fortunate than themselves.
We have heard the government says the NGOs, other non-governmental organizations can also help in building up the country and the communities. And that is what Jabulani is doing.
We want to work in partnership with the community to empower them to take control of their own development and of their health. And we now have a range of projects that cut across healthcare, education. We have community and microfinance projects to try and generate jobs for people in the area. And environmental projects is also an area that we're working in now.
Fold your arms.
Close your arms.
Close your eyes.
Close your eyes. Thank you for air so sweet. Thank you for the air to eat. Thank you, God, for everything. Amen. Open eyes.
Good, very good, very good. My job now, I'm a preschool teacher. The reason I like to be a preschool teacher, I like children, firstly. That is my talent. This is the beginning. This is only one preschool. I need more preschools around here. If we can find somebody who's going to train other teachers just to have preschools all around. If we can start with the youth, teach them how to make something, how to love your country, everything are going to be all right.
We're also active in agriculture and gardening projects. There's a woman called Notandikile Valu who drives this project. She's completely green-fingered and also a very natural teacher.
What I'm like to do is that to teach the people, even in their homes, to use a garden so that they must feed their children. If you have HIV, and TB, kwashiorkor and so on, the nurses and the doctors said you must eat vegetables because it is important. So it's a good idea to everybody. It's open to every people to practice.
We're bringing in skills from the outside, but we're trying to cultivate the skills that already exist here. Jabulani's been able to offer employment to some of the local people here, largely women. So we have employees such as Sipokazi, who spearheads our TB program.
My job is to do the statistics, to capture the data, to check if they do come and collect their treatment. And if they didn't come, we chase them.
Atini is one of our counsellors, one of our ARV counsellors who's employed by Jabulani and is our star counsellor. She does such an awesome job. She's so passionate about what she does.
That Jabulani is doing a very tremendous work in this hospital, especially in the line of renovating structures which are really very dilapidated.
If a woman has a complication with her pregnancy, it's very difficult to get to the hospital. We're talking about coming in a wheelbarrow in the middle of the night over 10 kilometres. The Waiting Mothers is self-catering accommodation for pregnant ladies. So if a woman reaches her term, she's 34 weeks, she's allowed to come in here, check in.
Jabulani has worked so much for us because if it were not for Jabulani, we wouldn't be having these rondavels, because these rondavels, of course, they were here, but they were not in good condition. But because of Jabulani Foundation, they helped us to renovate these rondavels.
The woman can stay here and she's very close to the care that she might need should there be a complication. We've worked in partnership with Andy Duncan and his team through the I Give a Damn project.
You know, Jabulani has a long-term vision in this community. Jabulani has a long-term investment. They know what it is that they need to do. They know what they need out of the accommodation.
We have the relationships with the community, we have links with local suppliers for construction materials, and we could really help to manage the project from the start right through to the finish.
It's been really great to be part of a bigger picture, and not just be a bunch of 12 guys arriving in the middle of nowhere and trying to do something useful.
We're also working in partnership with Roger Galloway. He's come to this area of the Transkei and fallen in love with it. He wants to teach people about the environment here and how you can conserve it and improve it.
Now, the reason I moved to the area in the first place was because of people like the LaRues and the Gaunts and the Jabulani Foundation, where the guys are so good at what they do and they're aware of the issues of the area, and they're doing something about it. They're not just sitting on their butts. And I find that incredibly challenging and inspiring, and I'd like to be part of that. We're setting up an eco-adventure club which combines environmental education with adventure tourism, where we're going to do everything from theoretical things from soil erosion to pollution to picking up litter, planting trees, erecting dustbins. We're hoping to link up with schools overseas and create relationships and work together on projects. We started an indigenous tree nursery to try reforest the area, because deforestation is a major problem in the area. People are cutting down forests and no one's actually planting it. If the natural environment is preserved, that can also assist in tourism, which is great for job creation as well.
A deeply rural place often intimidates people who are not used to it, and one of the advantages here is that there is good accommodation available, there's water, there's electricity most of the time, and we're really trying to develop a place that is the kind of place you'd be happy to live and work, hopefully for the medium to long term. We need people on the ground, but we also need people supporting us financially. We can't really do much without either one of those components. It's a place where your money goes a long way, but it also makes a tremendous difference. It's a part of the world that many have forgotten.
We need a lot more from the volunteer side of things. We need people to come and to run with these projects that we've spoken about. And I think the most important thing we need in a volunteer is somebody who sees one of these projects or identifies another need that they want to meet.
We hope that we'll be able to look back at the whole community in time and see the difference that we've been part of.